Thank you very much for inviting me to speak at this symposium. I'd like to thank especially Lucas because he managed to introduce the main question that my research is about, which is the importance of early childhood experience in shaping our brain function. So understanding how exactly experience can shape brain function is an absolutely fundamental question in neuroscience. And one of the best examples we have of this early plasticity comes from the binocular visual system, and it's known as amblyopia. So amblyopia is actually the most common childhood vision disorder, and we would have all seen children wearing an eye patch running around in the playground. So they're receiving treatment for amblyopia. And amblyopia is caused by abnormal visual experience, abnormal binocular visual experience in early childhood. And the most common risk factors are misalignment of the eye, which is strabismus, or unequal optic blur, which is called anisometropia. But the main thing to remember is that even though the risk factors are associated with the eyes, it actually affects the visual brain. So to understand why this is an important question to study, let's have a look at what the world looks like through the eyes of an amblyope. So you would have one eye that's really good and one eye that's really bad, which would allow you to see sharp images through your fellow eye, for example, when you're reading or when you're looking at close by objects, and blurry images when you're looking through your amblyopic eye. Now, when it comes to the bottom two pictures, a person going down the stairs or pouring tea, you may have a sharp image, but the thing is that amblyopia is also associated with an impairment of binocular vision. So you wouldn't have the stereoscopic cues to make these percepts very confident. But the biggest risk in amblyopia is actually that one eye is seeing poorly because of amblyopia, but then accident or disease could take away vision in the good eye, which leaves people visually impaired. So there are good reasons to study amblyopia also from the clinical perspective. So where do we think amblyopia takes its root? And it's pretty much established that the anatomical locus of amblyopia is most likely to reside in the primary visual cortex. Why do we think this is happening there? It's because input from left and right eyes are combined for the very first time in the primary visual cortex. But what kind of mechanism could actually help, or not actually help, but actually balance the input from the good eye and the bad eye? Research from primarily animal models has suggested that it is GABAergic inhibition in the primary visual cortex, which might be causing this imbalance, for example, by strengthening the inhibition upon the poor eye, whereas the inhibition on the good eye is normal. So there are some very good reasons to understand how GABAergic inhibition might be causing amblyopia in the human brain. But we cannot use any invasive methods in the human. So what can we use to look at GABAergic inhibition in the human brain? So there is a method called proton MR spectroscopy, which is a type of non-invasive imaging sequence, which allows us to use spectroscopy to look at different neurochemicals within a particular cubic volume of tissue in the brain. So looking at the resonance of protons within these chemical structures, we're able to tell their identity. And looking at their amplitude, we can know how much of it is in the visual brain. So it will give us sometimes 16 different neurochemicals. And luckily for us, it will also give us a readout of glutamate and GABA, which are the primary excitatory and inhibitory neurotransmitters in the brain involved in processing and plasticity. So one of the questions could be, well, this voxel is really, really big. How do we know that we can actually use it to understand perception in the binocular visual system? So we have shown that we're able to relate the small differences in eye dominance in normally sighted to concentrations of GABA in the early visual cortex using MR spectroscopy. So in this example, you would all be familiar with binocular rivalry stimuli. One eye will see leftwards grading, the other eye will see rightwards grading, and depending on the alternation duration, you would be able to tell which of these eyes is the dominant one. So we've done this in a number of participants, and we've calculated a metric of percentage eye dominance. We've also measured GABAergic inhibition in the visual cortex in these participants, and we were able to show that eye dominance correlates with the difference in GABA between eyes. So this makes us think, if normally cited eye dominance correlates with GABA, could this also play a role in the case of pathological eye dominance in amblyopia? So today's presentation is really about a single study, which we've done to look at this question using MR spectroscopy. And our hypotheses, we're looking at changes in GABA depending on how these amblyopes would see the world, predicting that when the fellow eye, the strong eye, is involved, that GABA would be increased, whereas when the amblyopic eye is stimulated, GABA would probably decrease. We also had a second hypothesis, which predicted that how poorly they see with their amblyopic eye would scale with the amount of GABA in the early visual cortex. So our methods were to scan amblyopes, adult amblyopes, using a visual stimulation paradigm where they were looking at flashing checkerboards either with both eyes, with their amblyopic eye or their fellow eye, or they had their eyes closed. And we also measured their visual acuity on their good eye and their bad eye. And we calculated the difference in the visual acuity to understand how deep is their amblyopia. So in summary, we had 28 people participate, 28 adult amblyopes. They took part in vision screening to assess their visual acuity, and then they were scanned, and we placed a measurement area, which is called a voxel, in the early visual cortex to test the main hypothesis. And we also had a voxel placed in the posterior cingulate cortex to establish if effects were specific to the early visual cortex. So let's have a look at the results. Does GABA actually change with viewing condition? So we can see immediately that these levels do not change at all, depending on whether they saw the stimuli with their both eyes, with their good eye, the bad eye, or their eyes closed. That was actually a surprise. And we also looked at glutamate in the early visual cortex. And again, there wasn't really anything happening depending on the viewing condition. So that doesn't mean that GABA is not related to the behavior deficit. So as the next step to test the second hypothesis, what we looked at was look at the range of visual acuity differences. If you look on the plot on the left-hand side, you will see that obviously these people have big differences in visual acuity when you look at the VA in the fellow eye and the amblyopic eye. But you will also see that there's a huge range of losses in this cohort. So what we wanted to do was basically take GABA measurements from the early visual cortex and correlate them to the difference in visual acuity. If they're correlated positively, it would mean that maybe inhibition is actively causing, inhibition from the fellow eye is actively causing the amblyopic deficit. If it's a negative correlation, it could mean that a weaker inhibition from the amblyopic eye could be causing the deficit. So what did we find? We actually found weak evidence for a negative correlation for GABA and visual acuity loss. So you would think, okay, this is interesting, but maybe this can also be caused by quality differences. You know, some scans are good, some scans are bad. And what if the people who have deeper visual acuity loss just had worse scans? So what we did was we used a control metabolite, which is glutamate, which is in the same spectrum as the GABA, and we did the same correlation basically to see if there was also a relationship, and there wasn't. any evidence for a relationship between acuity loss and glutamate. So the next thing would be to ask, okay, well, you can find a correlation in GABA with visual acuity in the early visual cortex, but maybe this is just something that's quite general across these people's brains. Is it really specific to the early visual cortex? So what we did was looking at the GABA concentrations in the control region, which is in the posterior cingulate cortex. That's the same correlation. And again, we didn't find any correlation between GABA and visual acuity loss. So even though the correlation in the visual cortex was weak, it was specific to GABA and it was specific to the early visual cortex. So at the beginning, I introduced two risk factors to amblyopia. One was strabismus and one was anisometropia. And in our cohort, we actually had a number of each of these subtypes in the study. So we took the opportunity to look at the correlations within subtypes. And what we found was that there actually was a difference in how they related to GABA. So anisometropic amblyopes who had a blurry eye in childhood correlated with GABA, but strabismic amblyopes didn't. Now 10 plus 13 doesn't add up to 28. We also had 5 amblyopes with mixed etiology of amblyopes. So they had both anisometropic and strabismic risk factors. And when these were added to the group, nothing really changed. So this suggests that there is some heterogeneity in the way that amblyopia relates to the visual brain, depending on what risk factors people had. So let me recap what I've just presented. Amblyopia is a very important model in neuroscience to understand how sensory experience in early childhood can shape our brain function. And in this presentation, I showed that we found weak evidence for a role of GABA in visual acuity loss, which suggests, the negative correlation suggests that amblyopia might be linked to a failure to inhibit the strong eye. So basically, these results suggest that loss of inhibition in early visual cortex has a weak relationship, but the relationship, as I said, is not a very strong one. So what could be the cause for this slightly weaker relationship? I think that overall, this data suggests that amblyopia is a pretty complex condition, especially in the human visual brain. And there are many kinds of sources of variability that could accumulate over lifetime at which we scan our participants. So for example, occlusion therapy could play a role, whether they wore glasses, if they had eye surgery, and what we also showed, the type of risk factor that caused their amblyopia. So one of the ways to address all these sources of variability is to image people at an early stage where they were not exposed to much life experience. And actually, that's one of the studies that we have going in the lab. We are scanning children with amblyopia, 5 to 8 years old, to look at their visual system before they start their patching therapy and 6 months after their patching therapy to understand whether GABA changes, whether GABA plays a role in amblyopia, and how patching therapy changes this relationship.
Thank you very much.